Hey guys, Dr. Brown here in Scottsdale, Arizona. I want to talk to you today about a topic that a lot of people fear, and that is the post-surgical drain. I want to talk a little bit about what this thing is, why do we use it, when do we take it out, and what's the care going to be like for it. So let me talk to you a little bit about first why we use it. I'm going to pick a tummy tuck as an example. During a tummy tuck procedure, we elevate all of the skin off of the abdominal muscles and then we lay it back down. Well, that's a big potential space for wound healing fluids to collect. Anytime there's a wound, fluids collect from the body to migrate all the cells to the tissue to heal it. We don't want you to get a big fluid collection between those two layers, and that's called a seroma. So we place a surgical drain that allows all of that fluid to egress out into this little bottle, and that way the two layers can then scar back together. So we simply use a drain when there's a big potential space to collect fluid. Okay, other places we might use that would be sometimes in revisionary breast surgery, thigh lifts, there's other things, breast reductions, you might see a drain used in that situation, but not all the time. So once the drain is in place, there's a few things that you're gonna have to do at home. You're gonna need someone to help you with, and we'll go over the drain care in the office. Now, we usually leave the drain in depending on how much fluid is coming out, and you'll notice on this little bottle called a Jackson Pratt drain, there's little numbers on here that measures in milliliters how much fluid is in here. The way that we know when these tubes can come out is by how much fluid is coming out in a 24-hour period. A general rule that we go by is we'd like to see 30 milliliters or less for 2 to 3 days consecutively in order to pull the drain. But coupled with that is a physical examination. Sometimes if a patient's not having a lot of output, the drain could just be clogged, and when I see you in the office, I can feel and see the fluid underneath the skin, and we have to unclog the drain to allow all that fluid to come out and then allow it to stay in for several more days. In general, a drain will stay in for 7 days. There are very few times that I ever take a drain out before 1 week. So when you do finally come to the office and your numbers are looking good and it's time to take out the drain, how do we do that? Does it hurt? What's that process like? I will tell you that for the most part, it doesn't hurt. Yes, there are times when people will complain of burning or stinging, but in general, it doesn't hurt. I think the anticipation is more scary than actually pulling the drain out. Now, usually what will happen is this drain will be coming out of a certain part of the body, and there'll be a suture tied around the drain that's attached to the skin to hold it in place so that it can't get pulled out. We simply cut that stitch and slide the drain out in the office and cover the opening to allow it to scab and heal. That's general things that you need to know about a drain. We don't love putting them in, but they're there for a reason, and you need to understand that we don't use them because we don't like you. We use them because we want you to have the best result possible, and in order to do that, we occasionally need to drain an open space to allow the skin to contour and shape and do what it needs to do. So I hope that helps you guys understand drains and demystifies it a little bit and makes it a little bit less scary. I hope that I see you next time for the next topic. Have a great day.